Hello, students. I heartily welcome you to our online classes. I'm Mrs. Snehal Mori, and today we are going to learn Chapter 2nd of Civics. Name of the chapter: Role of the Government in Health. This is really very important chapter you should understand. So, I once again repeat the name of the chapter: Role of the Government in Health. So, let me first introduce this chapter to you. What are we going to study in this chapter? Introduction. In a democracy, people expect the government to work for their welfare. So, in the democracy, people are expecting certain things from the government, that the government should work for the welfare of the people. Now, why people are expecting? Why is government bound to do the things for people? This is what we are going to study in this chapter in detail. This could be true. The provisions of education, health, employment, housing for the development of roads, electricity, etc. Now, what are things government is doing? Government is providing us the provision of education, helping in employment, housing, and also it's developing the roads, it's giving electricity. Many types of work government is doing. Now, why the government is doing such kind of work for the people and how they are doing, this is we are going to study in the detail. Okay, in this chapter we shall examine the meanings and the problems related to health. So only we will relate to the health problems which the government is facing and also the citizens are facing in our country. Okay, now what are we going to study in this chapter? These are all the key points, main points which I have removed, and each point will be discussed in detail later on. Okay, so the first point: health or the healthcare in India, that is the public and the private healthcare. Next, the story of Hakim Sheikh. This is a very beautiful story of Hakim Sheikh. From that perspective, you can know what is the health condition in India. Third one, healthcare and equality. Healthcare and equality. Number 4, challenges to equal and quality healthcare facility and the role of the government in it. Fifth one, the Kerala experience. And the sixth and the last one, the Costa Rican approach. So, these all points we are going to discuss in detail in this chapter, and today in part 1 we will discuss few of them. Okay, so let's begin with what is health? What does the health mean? According to us, health means our ability to remain free from illness and injuries. If I ask you, you are healthy, that means I am not ill, right? Or I am not having any injury on my body. So, health is not only about the injury or about the disease. Other than disease, various factors also affect our health. Not only the diseases, but other factors are also tremendously affecting our health. For example, we should have clean drinking water, proper nutritious food, and so on. Next, health depends on the overall development of an individual. So, health depends. It's actually health. Health depends. This word is gone wrong over here. It's health. Health depends on the overall development of the individual. That means active and good spirit in every sphere of life, no mental strength, etc. Okay, so health is depending on what the overall development the individual is having. That means if he is having an active and good spirit in every sphere of life, he is very active, he is very good spirited in all aspects of his life. That means he is mentally strong, and not only and he is not having any mental strain. That means only physically strong is not important. We should be physically as well as mentally healthy. Okay. Next, healthcare in India. What is the need of healthcare? Now, why is it necessary for the government that people in India should be healthy? Okay, to prevent the and treat illness. First of all, what is the need for the healthcare? Now, why there are so many government hospitals? Why government is organizing a big health campaign for India? Now, a current issue is of coronavirus, dear children. Now, because of government is striving so hard, we are able to face this pandemic, right? Same way, what is government doing? Government is trying to prevent and treat the illness. We are required to have facilities such as health center, hospitals are required, laboratories are required for testing, ambulance services, blood banks, etc. These all words we have heard so many times from last few months due to the coronavirus, right? So these words are not new to you. Healthcare centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. In order to run such facilities, now who will run such facilities? There proper staff is required for it, right? So we need health workers, nurses, qualified doctors, health professionals to run hospitals, laboratories, blood banks, etc. Right? We also need medicines and equipments that are necessary for treating a patient. Only by the health worker or the doctors, if they are not provided with the proper medicines and the equipments, they won't be able to treat a patient. So it's very, very important that proper medicines and equipment should be provided to the health workers. Qualified doctors should be there, nurses should be there, so that a nation remains healthy. So now a very big question arises, dear children. Do we have all this in our country? Do we have proper health centers? Proper health care is taken in India? So there's a beautiful answer to it. See now here in this uh, what to say, in this box is taken from your book itself. It's there in your book. You will find where we are lagging behind. In India, we have used public healthcare system. It has ability to look after the health of the large section of its population. India is having a huge capacity to look after the health of a huge section of the population. Now, how is it's possible? We will discuss. See, this box is there in your book also. First, we will read the positive points. First one, India has a largest number of medical colleges in the world. Congratulations, dear students. We are having largest number of medical colleges in the world. It's a great thing, right? And is among the largest producers of doctors. When we are having huge number of medical colleges, obviously we are going to produce largest number of doctors. Approximately 15,000 new doctors qualify every year. 15,000 is not a small number, dear children. Every year around 15,000 doctors are qualified in India. Okay, next, healthcare facilities have grown substantially over the years. Now, how they have grown, let's see. In 1950, there were only 2,717 hospitals in India. That means after independence, there were only 2,717 hospitals in India. It increased in 1919 and there were 11,174 hospitals, and latest in 2000 the number grew up to 18,280. Now it's 2020, it has grew again, no? Its number is increasing. So we are having so qualified doctors, we are having a large number of what to say hospitals, we are not lacking in any of the resources. Then also healthcare is poor in India. Why? We will see this. Okay, India gets a large number of medical tourists. Now medical tourists, who are they? Tourist means what? A people visiting from a different place, right? So from abroad there are many people coming in India and treating themselves. Okay, there are patients who are coming in India from other countries to treat themselves, to cure themselves from a disease. So there are many medical tourists who are coming from many countries. Why they are coming? Because we are having the best hospitals, and also the main reason, the what to say, it's very very cheap in India. They don't spend a lot of money to cure themselves. Okay, the treatment procedure is very cheap, or in a less amount of money we can cure any of the disease in India, okay, compared to the other countries overall the world. So where were we? Okay, wait a moment. India is the third largest producer of medicines in the world and is also a large exporter of medicines. Now we have, first point, we have a huge number of doctors in. Okay, we are having a large number of medical colleges, so we are having a huge number of doctors. Next, we are having many of the hospitals. Now hospital number of hospitals are also growing. And the third important point, even we are having the sources such as medicines are, we are the largest, third largest in the entire world. We are the third largest producer of medicines, and we even export the medicines. Now these are all the plus point of our country. In spite of all this, the healthcare system in India is not up to mark or not appropriate. What are the reasons behind it? Let's study. Most doctors settle in urban areas. People in rural areas have to travel long distance to reach a doctor. The number of doctors with respect to the population is much less in the rural areas. This is a very important point. Many of the doctors, they always prefer settling in the urban areas. So rural areas people are having very 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 huge problem of traveling. When they are sick, when they are ill, they have to travel long distance because doctors are not available in the rural areas. Next point, about 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number is also isn't decreasing. Why are we not able to provide clean drinking water to all? 21% of communicable diseases are waterborne. For example, diarrhea, worm, hepatitis, etc. So we are not getting a clean water, so many of the diseases come from the water. That's why many of the people are falling ill in India, right? Half of the children in India do not get adequate food to eat and are undernourished. So when do we fall ill? When we don't have proper clean drinking water, we don't eat nutritious food, then at that time we fall ill, right dear children? So we get an infection from the unclean unhygienic water or a place, right? So whose duty is it? It's a government's duty to provide us with a clean water and also see that the children are getting proper nutrition. Okay, now how the government is doing its duty? Let's see. Okay, healthcare in India. With all the positive development, we are not able to provide proper health facilities to people. We are having so many plus points with us. In spite of that, our government is not able to provide proper healthcare facilities. Why do you think so? Due to very first point, lack of responsibility. Nobody is ready to take the responsibility to provide proper healthcare facility. The next point is very important: corruption. There is a huge corruption in healthcare facilities, and the people who deserve money from the government is they are not able to get that money. Okay, third one is our huge population. So because of these 3 points, our country is lacking behind in healthcare facilities, even though we are having all positive development in the medical terms. Okay, our country has money, knowledge, and people with experience. Very, very important. Our country is having money, it's having knowledge, and people with experience, but cannot make necessary healthcare available to all. Understand this through a story of Hakim Sheikh. Let us understand this through the story of Hakim Sheikh. Now, why is it happening so? Let us understand it through this story. It's Hakim Sheikh's story. It's a beautiful story, dear children. Hakim Sheikh was a member of Paschim Banga Khet Mazdur Samiti. I repeat again, Paschim Banga Khet Mazdur Samiti, PBKMS. It is an organization of agricultural laborers in West Bengal. In 1992, he accidentally fell off running train. Can you imagine? He fell off a running train and suffered from a head injuries. So he was taken to the government hospital in Kolkata. Now here, dear children, why did this person known as Hakim Sheikh preferred going to the government hospital? Why didn't he go to the private hospital? Can you understand, dear children? Because he was a common man. He was just a member of Paschim Banga Khet Mazdur Samiti. That means he was a common man, middle class man, and he cannot afford a huge price of private hospital. So he was taken to the government hospital in Kolkata. Next, what happened? Hospital refused to admit him and gave the reason that they do not have a spare bed. Hospital said, no, sorry, we cannot admit you in a hospital because we are not having any spare bed. So again he was taken to the another hospital, and in that hospital they don't have the facility or the specialized doctor to treat his head injury. And then in that condition he spent 14 hours in the critical stage. He was taken to the I repeat again, he was taken to 8 different government hospitals. None of them admitted him. See, it's a pity condition, dear children. He had spent 14 hours without any medical care. He had spent 14 hours in such a critical condition, and after that, he was taken to the 8 different government hospitals, and none of the hospital was ready to admit him. This is really very bad, right, dear children? Finally, after that, he gave up and he was admitted in private hospital and then received the treatment. So after that he understood, now government hospitals are of no use for me. I have to admit myself in the private hospital, and then he was admitted there and he received the treatment. In private hospitals, he spend a lot of money. Obviously, he has to spend a lot of money on his treatment in private hospital, right? He was very angry and upset with the attitude of the government hospitals. It's very natural that he will be very angry and upset, because not one or two, he had visited 8 hospitals in such a critical condition, and not a single hospital was ready to admit him as a patient. So obviously he'll be very angry and upset and towards the attitude of the government hospitals. So what happened after that? Hakim Sheikh and Paschim Banga Khet Mazdur Samiti, where he was working, okay, filed a case in the court. So he was so upset and angry that he filed a case against the government hospitals in the court. Now, who gave him right to file? On what basis? On what right did he file the case? On what ground can he file the case? Who is he to the hospital to ask a question that why didn't you admit me? Who gave him right to do so? We are going to learn further. Okay. Why do we pay taxes to the government? This all money which runs the government hospitals comes from the taxes which we pay to the government. And who pays the taxes? The common man or the citizens of India pays the taxes to the government. So Hakim Sheikh was very angry, saying that if we pay the taxes, why is the government failing to give us the proper facilities? On that basis, he filed a case against the hospitals, government hospitals in the court. Okay, connect this story with the Hakim Sheikh and find out the reason why he filed the case. Now you understood why he filed the case, right? We pay tax to the government so that government uses that money for providing many public services. Why do we pay tax to the government? Because in turn government uses that money for providing us with the public services. Now which all public services? Such as defense service, police, judicial system, building highways, etc. Now we are having a huge army, then we are having navy, air force, right? So defense services, then police are there, judicial systems are there, building highways. Who will do all this work? We will not set out every day out of the house and see, yes, you'll say, yeah, I will build a road from my house to the school and then I will go to the school. No, it's not our work. So citizens cannot organize this kind of services by themselves. So it's very essential that someone should take the responsibility on behalf of the citizens, and they will perform such kind of services, or they will give such kind of services. So on behalf of the citizens, the government is doing this work. So it's very, very important that government should provide all the required facilities to the citizens because they are paying tax to the government. Okay, dear children. Next, with the help of the tax, only development programs are funded. Services such as education, healthcare, employment, social welfare, vocational training, etc., are also provided through the money collected by the tax. The tax money plays a very important role in the relief and the rehabilitation of work. Now if suppose there is an earthquake anywhere in our country, so go the government, or the flood is there, so what happens, the government becomes active at this moment. They give they there are rescue programs, there are many so many things are there at that time, and government is helping all the people. They are doing rehabilitation, they are providing them with the money. Whose work is it? It's the government's work. Why it's their work? Because we are paying the tax to the government. On that tax we can think that the government should give us the facility in turn. So my dear children, we will stop here with the part first. This read this lesson, you will understand it more clearly once again, and for homework I will WhatsApp the questions personally, okay, on the group. Okay, I hope you have enjoyed watching today's video, and have a nice day, children. Thank you. If there are any doubts, you can ask me personally. Thank you. Thank you very much. Have a nice day.